Will your varicose veins go away by draining them? Now, the reason I bring this up is because I've actually discussed about varicose veins and whether they go away on their own on a previous video. But I recently had a patient who had seen a practitioner of some sort. I wasn't quite sure whether it was a health practitioner or someone else that told them that they could get rid of their varicose veins by doing other methods other than treatment. And essentially what they did was they stuck needles and cannulas into these veins and essentially drained them. And what the patient went through was that there was a lot of blood everywhere because these veins have a lot of pressure and they stuck these needles out, so there was gushing blood. They allowed the blood to gush for a period of time and squeezed them out, so there was really quite a lot of blood and seems quite gory. And following that, they put a couple of bandages and they compressed the leg. Now, the results that this patient found was that after about 2 or 3 months, it kind of worked where they felt it reduced in some way or form. They still were present, but they felt that they had gone down. But after about 2 or 3 months, everything then bulged again. Now, I'm not one to judge different treatments, but it just didn't really make sense because the whole idea of draining them almost makes it look like the issue is with your blood rather than with a mechanical issue, which is what happens in varicose veins where the valves don't function. So I would probably steer clear from going down this pathway of actually getting it drained because it just doesn't work. So to answer the question, do varicose veins go away, especially with draining? The answer is definitely no. Do they go away on their own? Generally they don't, but what patients do feel is that sometimes the aching kind of comes down, but I'm still not sure whether the aching actually comes down or they actually get used to it, which is something that happens if they've left it for a very long time. So they don't go away, and I would probably steer clear from doing unconventional treatments, especially if they're not going to get a result that lasts for a longer period. And if it's only going to last for 2 or 3 months, I don't think it's worth it at all.